Snakes can make great pets, and some smaller species are appropriate even for younger pet owners. When handled correctly, most snakes are gentle and seldom bite. Most are quiet and relatively easy to maintain. The enclosure should directly reflect the size of the snake. At a minimum, the enclosure should be large enough for the snake to stretch to full length. However, in reality, it should be as large as practical to allow exploring and exercise. Snakes are solitary and should be housed alone with visual barriers to block the sight of other snakes. The enclosure should have water and food bowls, as well as reptile furniture that can be used for climbing, basking, or hiding. The best substrate or material for the bottom of the enclosure is reptile carpet or newspaper. Avoid shavings, dirt, sand, or other particulate matter. An exception is a snake like the sand boa or other snakes that spend the majority of their time buried. For sand boas, provide a container within the enclosure with enough clean sand for them to bury themselves completely. This can easily be dumped and replaced with fresh sand. Provide multiple hide boxes and branches for climbing for species who like to spend their time in the branches of trees. All snakes, even desert species, should have a bowl of water large enough for the entire snake to completely or mostly immerse. Refer to other videos in our reptile series for information on temperature and humidity, as well as information on choosing a UV bulb for your snake. While snakes can be kept successfully without UV light, consider providing some UV time, especially for snakes that tend to bask in the sun in the wild. For snakes that are more active at dawn and dusk, provide a few hours of lower strength UV daily. This likely provides some health and other benefits. Almost all snakes eat whole prey in the wild. A few unusual snakes may primarily eat birds' eggs in the wild. Whole prey may include small mammals, insects, amphibians, and even smaller lizards and snakes. The most practical diet is high-quality rodents that have been well fed and are not older, diseased, or have been fed a poor quality diet. Ideally, all snakes are taught to eat prey that has been frozen, thawed, and warmed to body temperature. This prevents snake owners from having to care for and house stressed prey animals. In situations where snakes do not strike and kill the prey immediately, rodents can seriously injure snakes by biting and removing large sections of their skin. These kinds of wounds can be very difficult to repair. All snakes are fed to condition, meaning that the amount and frequency is adjusted to that which results in a healthy, slightly lean snake that is neither hungry all the time or overweight. Your veterinarian can help you evaluate your snake's body condition and make decisions on adjusting the feeding schedule. Snakes and their food, especially rodents, can carry dangerous bacteria which can be harmful to people. Be sure to separate reptiles, reptile food, bedding, cage furniture, and other supplies away from areas where people food is prepared and consumed. And remember to wash hands carefully after handling. Common illnesses include respiratory and GI disease, certain viral infections in some species, internal parasites, and in older snakes, some types of cancer. Many ill snakes refuse to eat. This can also occur when temperatures are too low and due to seasonal changes in reproductive hormones. A good checkup and in some cases diagnostic testing can help identify snakes that are not eating due to illness. For more information, contact your reptile veterinarian.